Welcome to USMLE Sarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
So, Dr. Shah, also talk a bit about in-person rotations that you offer.
Yeah, so this is something that I'm kind of always wanted to do it for the people is because yes, telemedicine is great. You get all this experiences, a lot of didactics, a lot of talks, but there's nothing like doing in-person rotation. So yes, the in-person rotation that I will be offering would involve clinic and hospital settings. So the way my schedule is, I'm usually working either 1 week in clinic, 1 week in hospital, or I do 2 week stretches at a time. So the way what it's going to be is you're going to be with me all this entire time. If I'm working the weekends, I don't expect you to work all the weekends, but you still expected to, work a Saturday with me if you feel like it. But sometimes I have a 14-day stretch where I work 14 days on the stretch and then I work, I have a day off. So depending on how my schedule is, you'll be able to rotate obviously in clinic, but you should also be able to rotate in the hospital with me as an observer. And for that, we will have you kind of go through the right avenues and get the paperwork. And me or Pavan or USMLE Sarthi will help you to navigate through that process. Because again, when you are shadowing with me in the hospital, you need that observer tag. And if you're an observer, it's very easy. The process is pretty fast. So you get to experience the busy part of being in a private practice, of how many patients I see, about 20, 21. So you get the feel of how every day works in the life of a doctor. And then you also get this opportunity to rotate in the hospital to get the feel of the hospital side setting. So I think it's a good mixture of inpatient and outpatient. And that's what we talked about initially when I was talking about the experiences, because you get here both part of it. And then and the hospitals that I'm affiliated with, or the hospitals I go to, have residency programs. So you get this opportunity to get introduced with the residents, because I know a lot of them, they rotate with me. And if you're lucky enough, I might have a medical student or a resident with me while you're rotating. So it's a good way to network, but also a good way to get that experience of inpatient and outpatient setting.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.